Welcome to Chat About with Rosalee Henry. Hi everyone, welcome back to Chat About with Rosalee Henry, where we have real conversation, one conversation at a time that transform lives. And today we have someone special with us, Representative Jasmine Clark. And we're going to be talking about things that affect everyday families, which are healthcare decisions. Dr. Representative Jasmine Clark, thank you so much for being here, and thank you to my audience for joining back to have this conversation, because we know that these are the things that affects us. Representative, you wear many hats. You are a scientist, you're an educator, you're a mother, but you're also out there campaigning for us, making sure that things are covered, policies are met. So can you tell me a little bit about yourself and what you're all about?
Yeah, so I am a mom. I'm a mom of two amazing children, Jada and Jacoby. One of them is in college. My son is in college.
Awesome.
My daughter is in high school. Outside of that, I am a college professor. I'm assistant clinical professor at the nursing school at Emory University.
Awesome.
And then I am also a sitting state representative representing Georgia's House District 108, which is located in Gwinnett County in the Lilburn area.
Awesome. I've seen you out there. I've gotten your notification in the mail. I've seen you in Congress. I've seen you at the Capitol doing the work. But what is the main healthcare issues that you're seeing that affecting everyday families?
I think it's really important for us to recognize, because a lot of times we talk about, oh, we need to fix healthcare, but what does that mean?
Yes.
Cost. The cost of healthcare is really hard for a lot of people.
Yes.
So, for example, there are people out there that do not have access to a doctor. They do not have health insurance. They don't even know or can't even fathom the idea of having a primary care physician or like their doctor. When they get sick, they are making some very difficult decisions. Like, am I sick enough to actually go to the doctor? Because if I go to the doctor, it's going to cost me a lot of money. And can I afford that? And if I'm sick, but I need to go to work and I have the type of job that doesn't let me have paid time off or paid sick leave, then am I ready to lose that income? Am I sick enough for that? And so there's way too many people in our communities and in our society that are more afraid of the healthcare bill than they are of what's making them sick in the first place.
Wow.
And so that's very, very concerning. It's one of the reasons why I really, truly believe that the cost of healthcare is a pressing issue that we need to fix and fix quickly.
That is so important. So based on what you're seeing out in the campaign field, what are families telling you that is affecting them the most when it comes to healthcare issues?
So we have people, again, who don't have a primary care physician. That's one thing.
Yes.
There's also people who don't have, let's say, a gynecologist or OBGYN in their area. There are parts of Georgia that have no pediatricians.
Yes, that is
as
true.
well. And so we have a lot of healthcare deserts in our state. Not just that. Let's say you do have access to a doctor. There are a lot of people that don't have access to a pharmacy. And so we have to be innovative in the way that we approach healthcare, because right now we have a lot of shortages, and unfortunately the policies that are being implemented or the policies that are in place right now are not addressing those shortages in a way that's actually serving the people. And so we've got more doctors retiring than becoming doctors and staying in the state of Georgia. So this is something that's going to continue to be an issue until policymakers take it seriously.
Wow, I can definitely understand that, and I can relate to that. I'm not sure if you know that right now in Savannah, they just closed a birthing center there. And you have mentioned about the deserted areas where they're closing hospitals. And a lot of times women are not seen, especially a woman who's pregnant, she's not seen a primary care doctor until birth, when she's giving birth, and that is so not acceptable, especially here in the US. So what policy are you pushing right now that is going to help families to get to where they need to get to help with the healthcare crisis, to stay out of the emergency room and be able to see a primary care doctor before it becomes an issue, before it becomes a crisis?
I think it's really important. So Georgia is one of the few states in the nation that has not expanded Medicaid.
Yes.
And what I mean by expanding Medicaid, I mean expanding the people who are eligible for Medicaid. And why is that important? Well, it's important because when you expand Medicaid, one, more people have access to care.
Yes.
But two, the state has access to federal funds. Right now, we are turning those funds away in the tune of billions of dollars.
Yes.
And the consequence of us turning those funds away is that hospitals are closing, or even if the whole hospital doesn't close, the labor and delivery closes, the birthing centers close, the doctors close their offices, the pharmacies shut their doors. This is a crisis of epic proportion in our state, and so the first thing I would say is expanding Medicaid in the state of Georgia.
Yes.
But also, I'm running for Congress, and in Congress, I think there are a lot of things we need to do. The budget bill that passed last summer cut Medicaid and Medicare and so many other forms of health care for people. They did not extend the ACA premium tax credits, for example. You know what the consequence of that was? In the state of Georgia, at the end of the year, they projected 200,000 people would drop their insurance because the price of their health insurance doubled or tripled.
Yes.
Guess what we just found out? It was more than double that. 500,000 Georgians lost their health care. That is a 37% decrease in the number of people who were insured this time last year that no longer have access to health insurance and therefore no longer have access to that doctor. These are the people that are making those difficult decisions. So as a state representative, I'm fighting at the state level to expand healthcare access. But at the federal level, I will fight to make sure that we are fully funding healthcare. And actually, what we need to do is sit down at the table, be adults in the room, and get universal healthcare in the United States.
That is so important, and I'm going to take a break on that. And when we come back, I want you to touch on what is going on right now with Medicaid, and the secretary want to take that away from families who are supporting their loved ones in the home. So we're going to take a break, and we will be right back. So again, this is Rosalee with Representative Jasmine Clark, and we are going to be talking about the issues that affecting everyday families when it comes to healthcare. See you right back.
Scientists analyze evidence. We seek truth. And the truth is, America is at a crossroads. Are we going to surrender to Trump and MAGA as they attack Georgia families? Or will we fight back? I'm Jasmine Clark, and I'm running for Congress to be the fighter Georgia needs. I stand on the shoulders of heroes who've broken barriers ahead of me and made it possible for me to break barriers of my own. My dad is a doctor. My mom is a nurse. I'm a professor of biology and a single mom who beat a Republican incumbent to serve you in the Georgia legislature. I ran to be a voice for science and truth in the face of Republican disinformation. And ever since, I've been taking on the toughest fights for Georgia families. I fought back against Governor Kemp and the MAGA Republicans attacking our abortion rights, our voting rights, and our health. And now I'm running for Congress to take that fight to Washington on behalf of Georgia families. I'll stand up to Trump and MAGA when they try to cut Medicare, destroy Georgia jobs, and gut medical research into cancer and Alzheimer's, and get to work building a stronger future for all of us, not just a powerful few. As a scientist, I seek truth. And the truth is, Georgia families need someone who shows up every day to fight for them and win. So join our campaign. There's not a moment to waste.
Chat About with Rosalee Henry. Welcome back to Chat About, and we have today Representative Clark, who is just as passionate about healthcare as I am. So, Representative Clark, I'm not sure if you hear what's going on in the news right now, where the U.S. Secretary took issue with medical pay for family caregivers. What's your take on that, and how do you think that is going to affect, or what impact you think that's going to have on the everyday families? Because for me, being out in the field, seeing what's going on, I know a lot of time that families uses their family members, or family members, not even say use, because that's kind of a strong word, but family members are the ones who are caring for their loved one. And it helps because if someone is, let's say, for instance, autistic or has any type of mental challenges, it is so much easier to have a family member who they are accustomed to in that home caring for that person. So how do you think that's going to impact if that actually goes through, which I'm praying it doesn't?
I pray it doesn't as well. And here's the truth. I think that there are way too many families that are dealing with this right now in our country. And we've already talked about how people already don't have access to health care.
Yes.
And so if you have the ability to take care of your family member in your home, not having to put them in a facility, you know, not having to depend on other people to come into your home, then you should have access to that. And I don't think that it is something that we should be moving away from. I think it's something that we should be moving toward.
Yes.
I think there are a lot of examples of how community is very important when taking care of those in our community that are sick. Yes. And but people need to be able to do it. If I'm having to take care of a family member, that means I'm probably not going to work.
Exactly.
This is now my job.
Full-time job.
And I still need to pay my bills.
Yes.
Don't make me choose between being able to take care of my parent or take care of another family member or take care of a child.
Exactly.
And having to go to work.
Yes.
RFK Jr. and the people in this Trump administration, unfortunately, do not actually understand a lot of the situations that families find themselves in. They're in a situation where they have access to care.
Yes.
They can pay whatever needs to be paid to do whatever it is they want to do. But for a lot of families, this is their option, and to take that option away is cruel.
It is.
And I think that our country, unfortunately, has way too much cruelty in policy.
That is so true. As someone who has been in different parts of healthcare, I had to take care of my mom. I also is a business owner in the healthcare industry. So I have teammates who goes into the home to do those jobs. And sometimes we cannot find qualified, trained caregivers. So why not have the family member? We can train those family members to do the same thing and keep their loved ones at home.
Right.
So I really hope and pray that this do not go through.
I hope so too. I really do hope that humanity can win at the end of the day.
Yes. Also, there's a lawsuit going on right now with midwives here in Georgia who are fighting to save not only Black and brown women, every mom who is pregnant and need that support. We should not have to take this to court. What's your take on that?
So we've talked about healthcare deserts, and the truth of the matter is we have a lot of maternity healthcare deserts in the state of Georgia. So many people in the state of Georgia do not have access to an OB.
Yes.
They do not have access to a gynecologist. If something goes wrong in their pregnancy, some of them have to travel an hour or more to the closest hospital that can actually help them.
Yes.
So in that instance, we need to expand the healthcare network that is able to help people in pregnancy. When we talk about expanding the healthcare network, the healthcare ecosystem, if you will, midwives are a part of that ecosystem.
Yes, they are.
We should be making sure that people have access to the birth and the birthing plan that they want.
Yes.
Instead of creating barriers to healthcare access. You know, it would be different if we just had healthcare everywhere and people could just go anywhere to get, but that's not the case. That's
no,
not
it's not
the case.
No, it's
and
not.
so it boggles my mind that we have people in positions of leadership in the state that are doing everything in their power to make things harder for women instead of doing the right thing and making sure that people have choices when it comes to their health care and their pregnancy care.
So we're hoping that you get elected. What would be your policy on making sure that women are protected, women have a voice, women can advocate for themselves, women don't have to be scared being pregnant?
So, I mean, it's a real issue. It's an issue in our country. Let's be very honest, reproductive health care is under attack.
Yes.
And when reproductive health care is under attack because there's certain people in our government that feel like certain people should have access and other people should not. Or they feel like certain people should be punished and other people should not. When you take away those healthcare choices, it has an impact on the entire, and I'm gonna use the word again, the entire ecosystem.
The entire.
Because here's the whole thing. When you go after reproductive health care, that affects access to contraceptives, that affects, you know, access to miscarriage care,
Lordy.
which unfortunately we have seen in the state of Georgia. We have lost women in our state, in the state of Georgia. And I'm gonna pause right here and bring up the fact that Georgia has one of the highest maternal mortality rates in the country.
They do.
So policies that make that worse are, again, they're cruel. They are inhumane. And so I am going to fight for reproductive choices because I know that when you have reproductive choices, it expands the ability for people to get the care that they need. We need to not criminalize our doctors for doing the standard of care for their patients. There are doctors that are leaving the state or they refuse to work in the state or they're retiring because Georgia's policies are basically criminalizing them for doing their job.
That is true.
We can't have that.
Yes. And we are going to break on that because, you know, I'm passionate when it comes to maternal health. So when we come back, we are going to pick this up because I want to talk about and just share with our audience the impact this have when we lose a mom. It's not just that family that's impacted, the community, the state. It is big. So please, stay with us. We're going to take a quick break and we will be right back.
Scientists analyze evidence. We seek truth. And the truth is, America is at a crossroads. Are we going to surrender to Trump and MAGA as they attack Georgia families? Or will we fight back? I'm Jasmine Clark, and I'm running for Congress to be the fighter Georgia needs. I stand on the shoulders of heroes who've broken barriers ahead of me and made it possible for me to break barriers of my own. My dad is a doctor. My mom is a nurse. I'm a professor of biology and a single mom who beat a Republican incumbent to serve you in the Georgia legislature. I ran to be a voice for science and truth in the face of Republican disinformation. And ever since, I've been taking on the toughest fights for Georgia families. I fought back against Governor Kemp and the MAGA Republicans attacking our abortion rights, our voting rights, and our health. And now I'm running for Congress to take that fight to Washington on behalf of Georgia families. I'll stand up to Trump and MAGA when they try to cut Medicare, destroy Georgia jobs, and gut medical research into cancer and Alzheimer's, and get to work building a stronger future for all of us, not just a powerful few. As a scientist, I seek truth. And the truth is, Georgia families need someone who shows up every day to fight for them and win. So join our campaign. There's not a moment to waste.
Thank you for watching Chat About with Rosalee Henry. Welcome back to Chat About with Rosalee Henry. And again, we have the lovely Representative Jasmine Clark here with us talking about the healthcare issues that is facing our state. I wasn't even talking about the country. Let's talk about the state. A lot of families right now are in that sandwich generation where they're caring for maybe a child with special need, a newborn, and also have to care for the aging parents. We talked earlier about the secretary now don't want to even pay for people who are doing that. What would be your stand, or what are you seeing right now that's going on that you would want to see changes and making sure that those families are more supported? What policies are you pushing right now to make sure that happen?
So when you talk about the sandwich generation,
Yes.
I am in the sandwich generation. I have children,
Yes.
My 2 children, as I mentioned earlier, but I also have aging parents. I have a
Yes.
father who is battling cancer.
Wow.
I have a mom, and she's not sick or anything, but she is getting older. And we consider all of those things in the decisions that we make. And so what I would say is that, again, policies need to acknowledge this. So that's when it comes to talking about things like cost. Because a lot of times when you are in the sandwich, you're not just thinking about taking care of yourself.
No, you're the last.
You are
sometimes you're the
also-
last
Yes.
one that you think about.
Exactly, because there's so many other people who need you.
Yes.
So you got to take care of your children. And when I'm talking about taking care of your children, I'm talking about things from like school stuff and, you know,
Doesn't matter the age. It
sickness.
doesn't
Yes,
matter the age.
exactly. All of those things you have to take into account. And let's be clear, those things aren't free.
Nope.
But then you're also taking care of an aging parent, making sure they're able to get to their appointments, making sure they're getting the care they need, making sure they're taking their medications.
Yes.
And so I think any policies that we implement need to acknowledge that. They need to acknowledge that there are people being pulled in multiple directions.
Yes.
And so we talk about things like, you know, paid leave. Paid leave should be able to be used for things like taking care of an aging parent. If you want to use your sick leave, a lot of times everyone's okay with you using sick leave to take care of your kid. But what if I needed to use sick leave to take care of my mom or my dad?
Yes.
So these are the types of things that, I love that you asked this question. They don't get talked about enough.
Nope, they don't.
They're just not talked about enough. And we need to have these conversations and bring people to the table that are willing to have these conversations. And so that's why I think it's very important to have a diversity of perspectives in our elected offices at every level of government. We need to have people that are experiencing different life things, so they bring
Lived
that
experience.
to the yes.
Lived experience,
Yes.
not just
Because
sitting
they bring
there.
that to the table,
Yes.
and they talk about the things that unfortunately I feel don't get talked about enough.
I totally agree with you. I always think that people should be the people in position that are talking about things should be able to talk about from a lived experience. Because you cannot tell me what it's like caring for my aging mom, my aging parents. I have no support. And now you're telling me that you're going to take that away from me, like you said, not getting paid.
Right.
Or even an entrepreneur who have to put that money aside, put that time aside to care for the aging parent, their special need child, or even sometimes their spouse.
Right. Exactly. And so I think that's very important. I think it's really important that we have those perspectives at the table. I think it's very important that we have those conversations when they need to be had. And I think it's very important that we not shy away
No.
from these issues.
It should be talked about and talked about more.
And let's be clear. We are currently in a country that is run by a man who thought that groceries was an old-fashioned term. You cannot tell me that a person who thinks that groceries is not a real word that people use anymore is in touch with the things that people are dealing with right now.
Well, if you're not going to the grocery store, then it's
you
not a
might
word.
think
You
that,
just go to the table and
I think
eat
the other
and
day
eat.
he said corner store wasn't a real word. I think it's just one of those things where we get these examples that the people that are making these policies aren't living the same life that we're living.
Not their lived experience.
And that's why we need to have people in the room that are.
Yes. When you think about stronger healthcare outcome, what does that look like for you?
Well, I want to see people be able to go to the doctor when they are sick and not have to think twice about what is this going to mean for my family? What is this going to mean for my wallet? What is this going to mean for my pocketbook? I want people to also get preventative care and not think twice about it. They go to the doctor because we all know an ounce of prevention is worth a pound of cure.
Yes.
So people going to the doctor, in the state of Georgia, there are people right now who don't have access to health insurance, but if they get pregnant, they can get pregnancy Medicaid. So some of those people, the first time they actually have a doctor is when they're pregnant.
Yes.
And then that is when they find out they have high blood pressure, they have high cholesterol, they are diabetic. They are finding out all these health things at the same time that they're having a life-changing thing happen in their body. So I think it's really important that we have people in positions to actually make sure that we're putting forth policies that help people before things get to that point.
Yes. I would love for us to start acting proactively.
Absolutely.
Instead of reactive and in crisis.
Absolutely.
Representative Clark, if you could talk to one person right now who is thinking that, one, they're not going to vote, or two, the policies that you're pushing, which is healthcare, they may feel like that doesn't resonate with them because they may be young, they may be healthy, they may not think that they need healthcare. What would you say to that person to, one, not only think that this is not only about them, they should vote, but also that they should vote for you?
I think that there is not a single solitary person in this state, in this country, in the world that is not impacted by healthcare in some way.
Yes.
You can be the youngest, healthiest person and there be an accident.
Yes.
And you're going to need healthcare.
Yes.
You can be pregnant and your pregnancy be proceeding beautifully and there being an emergency.
Yes.
You can be in a situation where you need healthcare tomorrow when you didn't need it yesterday. And even if you're not on Medicaid, even if you have private insurance, even if you're one of those people, they're like, I got money, I can pay for my healthcare. Guess what? When other people don't have access, it raises the cost for you.
That is so true.
This is an ecosystem.
Yes.
We are all connected to each other.
Yes.
And that's how policy works. And that's why you need to vote, because you might not think you're voting for yourself, but you are.
Yes. On that note, I want to say thank you so much for being here. It has been a pleasure talking with you. Again, I am Rosalee Henry, and this is the reason why I started Mothers Helping Hands, to help the community, to make sure that we have the resources to not only for the newborn, the moms who are going through postpartum, but also for the elderly, the people who need that support. So if you or someone you know need support, whether it's postpartum, post-op surgery that they have gone through, or just being able to keep your mom, dad at home, please reach out to us. Rosalee Henry at mothershelpinghandsatlanta.com. Thank you again so much. And to my audience, thank you for being part of this. And we look forward to seeing you on our next episode.